comment. And with that, I'd like to have everyone rise and Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I think, just for the interest of bringing up one of our commissioners here, if
Roll call of the committee.
roll call, I need it.
Amo, Anagnostakis,
Present.
Lujan, Sutherland, Tortel, Tui, O'Donnell. 6 present, 1 absent.
Okay, I'd like to jump around on the agenda a little bit, and Commissioner Miller, if you would like to come up and continue with your Department of Health monthly update, we'll move you up first. Yes. Mental health, I'm sorry. I'm jumping you over the others and in the interest of
Oh, no,
moving you
listen.
along.
The team over at the health department, we don't know what we would do without them, right? They've been awesome.
My mistake, sorry.
I apologize. I was talking. I apologize.
No problem.
So just to give you some updates, let me see. We have had communication back from Assemblywoman Gunther's office. We anticipate, and the New York State Office of Mental Health, who will pass the $1 million funds over to us. We look forward to receiving them hopefully sometime this week. I've had a meeting with the Police Chiefs Association that went very well. We're looking forward to expanding our collaborative work with them across this crisis continuum and really using that money as a pilot to show how that investment really will lead to better outcomes overall. So that's good news for us. You all are aware, I believe, County Attorney Langdon Chapman has presented to you about the funds that will be coming in from the Johnson & Johnson settlement, and that there will be some discussion here in the county directed by the county executive about how those funds might be used. So we appreciate that, those funds being received and the efforts that went into making that happen. And I will look forward to being part of that conversation about where they'll fit in across our community and make the most difference.
Commissioner, with that, do you know, I've heard varying amounts.
Yeah.
Do you know what the amount is today, or a guesstimate?
No, I haven't been given a consistent amount. The amounts that are included here are lower below of between 4 million and 7.6 million. These are the amounts that were quoted at the time that I believe Attorney General James was here presenting the check to Orange County.
Thanks.
I don't know if we mentioned here before, but the governor has passed legislation that seeks to require jail-based medication assistance programs in all jails, which means they would have to not only continue treatment for those who come in with an opioid and or alcohol addiction that would benefit from medication-assisted treatment. That would include methadone, buprenorphine, and Vivitrol for opioids, as well as Antabuse and some other supports for those who are struggling with alcohol. That will be an expense that really falls to county taxation for local jails, and each jail will be responsible for building up partnerships and putting in process that will allow that to happen for continued medication for those who come in with it, and for induction for those who come in with the addiction not currently taking medication. As you know, Orange County Jail is in contract with WellPath, and they're providing their behavioral health services as well as their medical services for them. They will be sorting that out. My role is through the New York State OASIS. They will be providing some funds to Orange County that will come in through my budget that I will then transfer over to the jail's budget so they can add them to their WellPath contract. It totals about $290,000. So we are looking to work out that agreement so that they can receive those funds to help to assist with the cost of medication-assisted treatment in Orange County Jail. And just to say,
I have a question from Legislator Lujan.
Thank you, Commissioner.
Hi.
Just very briefly, so the funds that we're going to be receiving for the Johnson Johnson settlement, are we able to use those funds, for instance, for housing for individuals who are struggling with substance abuse?
yes, that can be one of the options.
Because one of the things that, what we've seen, unfortunately, is that a lot of the people who are coming out of jail, or prison, one of the biggest struggles, as you well know, is been the struggle of finding housing. So it's definitely, I would hope that would be a priority that would be
It'd be like halfway housing and or sober housing. Not so much permanent housing, but it would be,
transitional.
exactly, yes.
And for transitional housing, would it be more of 3 months, 6 months, a year? How do we normally look at transitional housing?
Well, each program is developed uniquely depending on the design and depending on the level of care. Currently, we don't have those options here in Orange County, so it certainly would fill a gap.
Excellent.
Okay. All right, if you could continue.
We talked about the last time we were here about the challenge to get children and youth connected with mental health treatment and our work with pediatricians. We've had 2 very successful meetings with the pediatricians. The health department did join us for the first one. And we have come to the conclusion together that we're putting together a survey that will go out to pediatricians across the county. We just completed a draft of that, really asking them what they're currently doing with their young people and how they're assessing them, whether they're treating them, whether they're providing medication, what kind of trainings might be helpful for them. We know that our pediatricians are part of our solution. They have been part of the solution from the beginning of time, but the demand on them is even greater now because we have greater need for our young people, and we don't have enough psychiatry and or psychiatric prescribing to support all of that need. So that will happen. We're also coming up with a list of recommended screening tools for them to use, and most importantly, just thanking them for their efforts and drawing them in to work more closely with our behavioral health system.
With the psychiatric help for the children, it's, I would think that you'd want to have them in person versus telehealth, whereas a solution that may come up would be telehealth from some psychiatrist that may not be around, the area, or what have you been hearing?
Yeah, for children in particular, especially if you're concerned about any risk in the home or need for confidentiality, telehealth can be a little complicated because you don't know if mom is standing over the corner, listening in. So we want to be respectful of what the needs are based on the circumstances. But telehealth has been very successful for some young people.
Okay. But you're trying to, what would they do? Try to find some psychiatrists to come in and...
Right, we work, and in fact, New York State Office of Mental Health has offered incentive dollars based on their American Rescue Funds. We, for our own county-operated clinic, are looking to access some of those funds to help persuade child prescribers to come into our clinic by giving them a hiring bonus. So those are some of the things that are happening to try to sway those experts to come into our county.
Okay. Thank you.
And let me think, what else do I have? Oh, just the, I put on here about the OPWDD and really it's stakeholder meetings, and this is a further discussion. We were talking about home care earlier. Same in the developmental disability IDDD system. We have a shortage of staff coming into those entry-level positions. When we think about, workforce or affordable housing in the county, we have to keep in mind that people who are taking care of our loved ones are only making $14 to $15 an hour. Those are the folks who live in affordable housing. So we have to have places for them to live. We have to look at what we're paying them. It was mentioned this morning at a meeting I was at that, Panera is paying $18 an hour. So, $14 an hour to take care of someone with significant behavioral health needs and or to, care for someone with Alzheimer's who's 85 years old, we have to figure out, and all we can do to be ambassadors of that message and advocate, I think, is really important. So I'll leave it at that, but thank you.
Legislator Sutherland, did you have a question?
I'm sorry, Commissioner Miller, did you state when that next follow-up meeting is with the pediatricians and whatnot?
Yes, next week.
Next week, okay. Is there a way you can get, the information to us as to how, that ends up and if there's anything that we can do to help out with that? Also, is there going to be involvement with the school districts, trying to, work together with the school districts to try to get some of these children some help? Because I know I have students who, are really could use somebody to talk to, and it's impossible to find somebody to get that help for them.
Yes, exactly. I think that we have contact with most school districts, and we respond to any requests that come in. I think one thing I mentioned the last time we were here was certainly to call 311 or 1-800-832-1200, which is our Orange County Crisis Call Center, but also to call our department, Angela Turk in my department at 291-2610. She has been helping so many families navigate through the system, as well as our single point of access. You're right, it's a struggle. We know what we know, so if we know all we know, and we're struggling to get people connected, families who don't know what we know are having even more difficulty. So we don't want to stop until they get connected. Just sometimes it's a longer path than what we'd wish it would be. Absolutely will. Can even share with you, if you're interested, the draft survey that we're putting out and the list of recommended tools that we're putting out for our pediatricians. Okay, will do.
Okay, do you have a few more items here? Or?
Oh, do I have more items? I feel like I'm taking up too much of your time. I mentioned here again about the workforce. We appreciate the OPWDD, OMH, and OASIS all using American Rescue Funds, acknowledging the workforce shortages. So some are using them for hiring bonuses, some are using them for incentives, work incentives. OPWDD even has, if you worked 3 consecutive months during the pandemic and you are vaccinated, you can get up to $1,000 as an employee. They're really trying to retain staff in the systems because they're struggling to, man their houses, their group homes. They're struggling to man their schools. It's really a great struggle. This is just another message. We had, again, yesterday, there was an alert for overdoses. So I know that I've sent you all the material in the past, and I'd be glad to send it again. For any of your social media sites, if you can put on there recommending people reach out for treatment. The alerts go out with a flyer attached to it, recommended for how people can connect to services. When we have more than 5 overdoses, not meaning they may not be fatalities, they may survive the overdose, but more than 5 overdoses within a 24-hour period, we send that announcement out to all of our providers in the system, so that they can be aware, so they can reach out to their vulnerable clients, so that family members can be notified to watch out for their loved ones, so we'll be sure people have Narcan on hand. It's just a way of trying to save lives.
Are we doing Narcan training in any of your departments? Or?
Yes, we have regularly scheduled Narcan trainings on our Orange County Department of Mental Health website. There is information about some of those Narcan trainings, but I can also send you that information if you'd like.
Great.
Will
Okay,
do.
thanks. Any other questions or comments, my legislators? Okay, thank you very much. Oh, Lori, Legislator Tortel.
If there's interest from my fellow legislators, maybe we can schedule something in the new year for legislators to be trained in Narcan.
Sure, absolutely.
Definitely, good idea.
Absolutely, will do. You just let us know, and we'll put that schedule together. Tammy Ryan from my department, some of you may have met her. She's Director of Chemical Dependency Services. She coordinates that for us, and she'd be glad to set that up.
Yeah.
Okay?
Okay,
All right.
great, thank you.
Thank you.
Commissioner.
Take good care. Thank you all. Thank you for letting me go first.
All right, we'll get back to the regular agenda. First up is Lawrence Ledoux, Commissioner of Valley View, and Donna Strecker, Director of Finance at Valley View Center. Good afternoon.
Good afternoon. How are you?
Good, thanks. Let you get settled there.
I'm ready when you are.
Okay, on item 1A, we have a request supplemental appropriation for proposed 2021 capital expenditure to continue the kitchen flooring project. $95,000 appropriated from appropriated surplus. Legislative request number 212. May I have a motion? Lujan and Tortel. Okay.
So we have $67,000 already available, but we are requesting additional funding. Back last year, we made some temporary repairs to some tiles and grates in the work area of the kitchen for safety reasons for our employees. but permanent work still needs to be done. We need to replace some steel floor under the kettles, install some new floor drains, there's a wall behind the kettles that needs to be assessed for rebuild or removal, and the epoxy floor under the dish machine needs to be redone. So we just made some temporary fixes during the pandemic, and we have some larger projects now that we need to address going forward.
Okay, then this should finish up the kitchen,
Well, I hope so, yes, yes.
unless anything else gets uncovered. All right, any questions or comments? Legislator Nagustakis?
Thank you, Mr. Chairman. Remind me, when were we gonna, we had talked about not taking out of reserves anymore and starting to bond again. Did we have a definitive date when we would cross over on that? January 1st, we're gonna start? Okay, great, thank you.
And if we have an updated report on the cash balance, I think you guys requested that. Donna will report on that.
45 million or so?
Correct, but she'll give a more detailed report,
Great,
so.
thank you.
Yep.
Okay, any other comments, questions? Not seeing any, I'll call the question. All in favor, say aye. Aye. Opposed? None, motion carries. All right, Commissioner, we have item 1B, request supplemental appropriation for a proposed 2021 capital expenditure for upgrading dietary food service equipment for $50,000. Appropriated surplus, legislative request number 213. May I have a motion? Legislator Tortel, second. Legislator Lujan. Okay.
Thank you. We do a $50,000 request annually for upgrading kitchen equipment. It looks like we have a quote in here for a new gas kettle, which would be just approximately $50,000. So we do this annually. And just a reminder, an expense like this would be returned to us in the capital portion of our rate, of our Medicaid rate.
Any questions or comments? Not seeing any, I'll call the question. All in favor, say aye. Aye. All opposed? Motion carries. Legislator Nagustakis.
Thank you. Before we go on, since we have the commissioner here, can I ask about a project that we've talked about in the past? Very briefly. I had a constituent call me today, and we discussed in length. She was concerned about the sewer plant. And I know we've talked about making repairs. Can you tell us the status on that? And also in the conversation, there was reference to a letter coming from the DEC a couple of years ago. And how do we stand in correcting whatever problems that they pointed out?
Yeah, we're going to have a full facility assessment done, which will include the sewer plant to see what needs to be addressed. We had numerous repairs, and I can give you specific information next month. I didn't bring it with me. We've had numerous repairs to the sewer plant within the last 2 years. The DEC, there was a complaint from the apartment building that is right next to the sewer plant, the independent apartment building, that of the complaint of the smell, and all we needed to do was increase the time that the aerator was on in the sewer plant, and that solved the problem.
Okay, and
So-
you bring information next
I can bring it next time about, what we've done expense-wise and the repairs that we've had done.
Do we still have ongoing operations to correct problems there, or we're completed with it?
The problems are corrected, yeah. You guys have approved money for repairs.
Yeah.
And we've used the majority of that money. I think, was it last month or the previous month, we put in for additional money just in case we need to have repairs done. But we will have a facility assessment, not only on the sewer plant, but on our HVAC, on all these items. The water, we have a water tank, a bunch of things. And then hopefully we'll come out with a 5-year plan on what needs to be addressed first, and so on and so on.
And when do you expect to bring that forward to us?
We're working on the RFP now. I'm hoping that we can get that out within the next month or two, and then, we'll have to review all the proposals and, approve it. So we're working on it.
Okay.
Yeah.
Outstanding.
Yep.
Thank you.
Any other questions? Okay, we'll move down to item 1C. Reallocate Director of Staff Resources, position grade 16 to grade 17, legislative request number 211. May I have a motion? first, Lori Totel, Kevin Darian.
So, yeah, C, D, E, and F are all sort of connected. We did them individually yesterday, I think, for the vote. But anyway, I'll give you a synopsis. You should have a memo from the Department of Human Resources in your packet. We did ask for a class study from Donna McCary of the Department of Human Resources. We recently had 2 of our employees in our Staff Resources Division retire, and we thought it was an appropriate time to do a class study. Our Staff Resources Division within Valley View is essentially a mini HR department. The Staff Resources Department is responsible for ensuring the staffing of our nursing staff for 3 shifts for 24-hour coverage. Additionally, the department has, well, let me go to the first one, the reallocation, the Director of Staff Resources. This position works with the, let's see here, ensures that the staffing department deadlines are met for the scheduling of nursing personnel on all 3 shifts, and ensures the adherence of department guidelines and policies relating to staffing and scheduling overtime. This position is now responsible for reviewing compliance with employee testing and vaccination against COVID-19, in relevance to the new Title 10 of the New York Codes, Rules, and Regulation. Additionally, this person is responsible for leave procedures and eligibility for pay related to COVID-19 are managed by the Director of Staff Resources. All departmental recruiting and employee onboarding are completed by the Director. Additional supervisory responsibilities and new procedures and methods for tracking, maintaining compliance with federal and state laws represent a material change in classification. This employee also is responsible for handling all employee disciplinary issues with myself as well.
Okay, any questions?
I'm sorry, jumped the gun.
Did you want to mention E?
Well, I'll just keep going down. You want me to just keep going, and then I'll refer to another sheet. So then, as part of this class study, HR recommended that we create a new classification, which is the Staff Resources Coordinator, which is a grade 10. This new position will assist with the coordination of payroll and personnel functions of the department. A new classification of Staff Resources Coordinator is recommended. This incumbent will ensure payroll deadlines are met and completion of all personnel transactions are timely to the Department of Human Resources. Additional responsibilities will include assisting the Director of Staff Resources with all employment recruitment for the facility. There should be a draft job description attached as well. And then the last part of this reclassification recommendation is to abolish 1 principal clerk, grade 7, create 1 payroll clerk, grade 7, and then with the retirement of 1 principal clerk, grade 7, is recommended that this position be abolished and a payroll clerk, grade 7 position be created. This classification is more suitable for the work to be performed and places greater emphasis on the processing of the biweekly payroll for the department. The payroll clerk position will be filled from the promotional civil service examination held on July 17, 2021. The department will not be seeking to backfill the vacancy resulting from the promotions. Staffing caps within the department will not be increased. Responsibilities performed by the principal clerk, which were relative to this maintaining personnel records, will be assigned to the newly created classification of Staff Resources Coordinator. If you look on the sheet that Doreen handed out, I just did our current budgeted positions, and then what our budgeted positions would look like if this was approved. So we're not increasing any positions. The Director of Staff Resources would go from a grade 16 to a grade 17. We'd have a new position of the Staff Resources Coordinator. We'd have a senior payroll clerk, which we already have. We would have an associate clerk, which we already have. And then we'd have 2 payroll clerks instead of 1, and then we would lose the senior clerk that is above.
And there's no additional fund that's coming from existing funds in your budget?
Correct, yes. As you know, we have no county taxation. Donna does describe on page 2 of the memo, the reallocation of the Director of Staff Resources is an increase of $289 per payroll based on step placement on the negotiated CSA salary schedule. Savings to be found through the separation of the former encumbrance of senior payroll clerk. She has the annualized salary there of just over $48,000, and the principal clerk annualized salary of just under $52,000.
Okay, thanks.
Yep.
Are there any questions or comments from my fellow legislators on the committee or any other legislators that are in the room? I think we need to vote on these all individually.
That's what we did yesterday in personnel.
Oh, you did? Okay,
Yes.
great. All right, so we'll do that. For item 1C, if there's no further questions or comments, I'd like to call a question. All in favor, say aye. And opposed? Motion passes. Item 1D, creation of staff resource coordinator, grade 10. Any other further discussion? Questions? Okay, yeah. I didn't do that already on the first one. Second, okay. Thank you. Any other further discussion now? Not seeing any? All in favor, say aye. Aye. All right, I'd like to get a motion on letter 1E, abolish one principal clerk, grade 7 position, legislative request number 211. Tortel and Lujan. Okay, any discussion? Not seeing any, I'll call the question. All in favor, say aye. Aye. All right, need a motion on item 1F, create one payroll clerk, grade 7, legislative request number 211. You both said at the same time. Who was first? Okay. Okay. Any further discussion or questions? Not seeing any. I call the question. All in favor, aye? Aye. Motion passes.
Thank you.
Okay, thanks, Commissioner. Up next, we have the monthly financials, and Donna, will you take care of that? Okay. Is your microphone on, though, or is it on? Or pull it closer, maybe? Oh, yeah, a little bit. Yep, yep. $4 million?
4 million.
4 million. Legislator Lujan, you have a question?
It's all COVID-related, so it's a voluminous spreadsheet that Donna's been working on. Lost revenues is obviously a huge portion for us, but then all the additional expenses related to COVID. And a lot of it's based on formulas. You know, we've had additional workloads, you know, as I mentioned here, for this one position upgrade. She's had to do COVID-related work. We've had staff that have had to do COVID-related work specific to testing, specific to reporting. So we're going to try and capture as much as we can. And I think, I don't know if they determine it based on the previous amount of money we've received also. So there's a lot of factors that are involved, and we're not sure. I wish we had an answer for you. We're hoping we get something.
Okay. Donna, you can continue.
I think, yeah, we're under 70 now.
70, yeah. Okay. Any questions or comments? Okay. Okay, and you said that the census had dropped to, I think it's 69.72%. And I would have to think that that would be because you haven't been accepting any new admissions, right? I think from the last meeting. I mean, how long is it that you've had since?
Been at least 2 weeks. We had unfortunately, I put it in the monthly update. We did have some COVID cases within the last 2 weeks of both residents and staff. Right now, we're good. We don't have any COVID positive residents in the building. We only have one staff member that's out, but because we had COVID positive residents in the building, we needed to utilize our COVID designated area, and that reduced the amount of beds we had to offer short-term rehab residents from the hospital. It's a two-factor issue. The first issue was the COVID cases within the facility. The second issue is staffing. We've had to close 2 units, and we're struggling to staff 9 units versus 11 units that we had. And I've said it before, and I'll say it again, this is not a Valley View issue. This is a healthcare issue. Look in the paper today. I think there's an article in the New York Post about New York City hospitals staffing issues. I kind of feel like Paul Revere here. The staffing shortage is here. It's not coming. It's here for healthcare, and it's sad. I believe there's 2 nursing homes in Orange County that had significant COVID outbreaks, not Valley View, other than Valley View, amongst their staff, and they had to stop taking admissions. I've turned away probably about 6 employees of the county that were looking for placement of a loved one or someone that they knew, and I've had to turn them away. It's awful. It's the worst thing I can do as a nursing home administrator, but if we don't have the
We've
staff
had
to
to
take
close
care of people.
previously too for a few weeks at a time.
What's that?
And you
We,
closed
we have closed at intermittent times, yeah.
different closures.
We've been closed 2 consecutive weeks now, and obviously it's hurting our census, and I'm not sure, we're assessing now if we can continue to take new admissions based on our staffing.
How many employees did you lose because of that weren't?
I don't have those numbers with me, but, it's a significant amount if we had to close 2 units, approximately 60 residents, so.
When I first read this and it had 98% of the staff have been vaccinated, I thought, what a great number. Then I realized that, well, it probably lost a lot, and that's where the number comes in.
We've lost,
Hi.
I don't have a count from the beginning of COVID, but we lost a lot of per diem staff. We've lost full-time staff that just left healthcare, and it's not, like I said previously, it's not just a Valley View issue, it's an issue across all healthcare. And now we're talking about losing access to care right here in Orange County, which is really a shame. And I'll say it again, the healthcare staffing crisis is here now. It needs to be addressed on a higher level. You guys, we need your support in addressing it. So.
I had legislator Anagostakis first, and then we'll go to legislative Lujan.
Thank you, Mr. Chairman. Lawrence, I'm going to kind of circle back around to where you just concluded, but I'll just kind of give my overview of what I see here, and if I see anything wrong, Donna will correct me, and somewhere along the way, I'll have a question for you. Sure. But basically, it looks like our revenues were down about $3 million. Our expenses were down about $2 million, so net, we were down about $1 million, but that's very understandable, just like you said, because basically the first quarter of last year was pre-COVID versus the year before versus this year is COVID, so that's where that impact is. Slightly concerning is it looks like our Medicare rate went down about 2.5 percentage points, so that's going to impact us a little bit. But my real concern is where you concluded. We're at 69, we're under 70% right now. We've got 2 units closed. You don't have enough people to staff to actually allow more residents to come in that need the service. Yet we've budgeted next year for 90%, I believe, on our budget. So the multiple questions. Number one, I see that as problematic because unless we're able to reopen 2 units in the next basically month and a half and get the whole facility up from a 70% to a 90% level, we're going to be starting right off the bat on the negative. And as long as those 2 units are closed and as long as we're at these kinds of levels, there is no way we're going to end up the year, if we go through the first couple of months, at 90%, because then we'd have to be 100% the rest of the way, and that's never going to happen. So am I correct in all that? What can we do right now to change things? I mean, you're looking for employees to come in, and you're not able to get them from even these other nursing homes that don't pay well and don't have benefits. I'm shocked that people don't want to make a transfer.
We barely get any nursing applications weekly. We advertise regularly on Indeed. We advertise through Orange County social media. We went to a job fair at Newburgh a couple weeks ago. Are people coming out of colleges with those degrees that we can go and recruit? They are, but it's not enough to keep up with the people that we've lost in the healthcare system. That's part of the problem. There's not enough nurses in school to fill all the positions, not only at Valley View, but at other facilities. We've been hurt additionally by, I just heard that Garnett was just offering a crazy bonus amount of pay for RNs. We're not competing with that. Some of the RNs that work on some of these COVID clinics, they get paid a lot more, believe it or not, than what we can offer them to get paid, and it's an easier job.
Have we lost any of our people to those offers?
I don't know, I don't know if we've done exit interviews on everybody, but I think we have lost some people, particularly per diem people. This is a problem. I just met with the county executive today where I put together a sign-on and referral bonus program. We're going to run it by the union. And we're hoping that maybe that we can get some people that way, but to remain competitive, because there's other facilities, like I said, nursing homes that are doing that in the area.
Now,
So-
of course, I don't envy your position. I would never want to be in it because I don't see the light at the end of the tunnel here. To compound things, we have the COVID situation still going on, and it pre-assumes to get to 90% that is over with, and I'm not quite sure that that's going to be the case. Your thoughts on that?
We still have, I mean, as of 2 weeks ago, we have 95% of our residents vaccinated, 98% of our staff vaccinated, and we're still having positive cases. So, yeah, there is no end to COVID as far as I see.
Are we in a position where we were in the beginning of this, where we're getting forced people from hospitals with COVID to us? Or
No,
is that
no,
over?
that ended. that
Totally
ended.
over?
Yeah, we don't take anybody.
Okay,
Yeah.
okay, all right.
So, yeah.
Whatever ideas you have.
Yeah,
I'm
we're,
open
we're,
to
we're
them.
trying, we're throwing everything that we can at it. You know, if you look at our census, we reached 80%, and
Right.
we were climbing there, and then all of a sudden, we just didn't have the staff to keep things going, and then I think this August coincided with the mandatory vaccination, which really didn't hurt us, but we haven't been able to replace the staff that we've lost. And we can't bring residents in and not take care of them. You know, we can't. So we're going to be responsible and take care of who we can take care of.
Okay.
So-
I know you're going to keep us abreast, and anything we can do, I'm sure this committee would be there to help
And,
you out.
you know, like I said, I don't know if I said it now, I said it to somebody earlier, it kills me to get a call for somebody looking for a bed and I have to turn them away. That's the worst thing I could do as an administrator. And how many times have I told you guys in the past that you guys are one of our best referral sources? And, you know, we can't help people now. And I've heard, you know, there's people from Orange County that have to go to Sullivan County and potentially Rockland County for rehab because there's no beds available in Orange County, which is really sad because we're in 2021 right now. Think about that. So it's a problem.
Legislator Lujan.
Thank you, Mr. Chairman. I just wanted to kind of, you know, again, go on a little bit with what my colleague just said. Obviously, this is something that we're seeing across the country. We're seeing it here. Being able to be competitive is going to be a really important aspect of this. Are we seeing what other places are doing to try to be competitive? I'm so happy to hear that you're thinking about a sign-on bonus. That was one of the things that I was going to mention in my earlier remarks. But also just, you know, perhaps we have to look at the salaries that we're hiring people at. Our commissioner just a moment ago, you know, mentioned, for example, that we have some individuals who are making $14, $15 an hour. They could be making more money working in other things. Perhaps we need to start looking at, are we really paying the staff the wages that they need, considering all the demand and, you know, everything else that goes with it. I'd be very open to looking at something that reevaluates how we're paying, because at the end of the day, we're losing more money, more revenue for not raising these salaries. And so, and not to mention the most important aspect, that our county residents are not getting served, which is just, you know, that's never where we want to be. We never want to be on the side of where we're not be able to provide services that are very necessary for our county residents. So I think that, you know, I hope that everyone here agrees. I'm pretty sure we all do, that, you know, thinking outside the box of what it is you need, I think you'll find that we'll be very receptive to trying to help you address that, because this is not just your problem. This is you know, this is something that's going on everywhere. So
I appreciate that. I don't know, is this still on? Yeah. I am participating in a leading age call every week for nursing homes, and they do a survey every week, and 60% of the nursing homes, I don't have the number that participated on the call, 60% of nursing homes have either closed units or stopped taking admissions because of this situation. So, and this just goes to my point, this isn't a Valley View issue, it's not an Orange County issue, it's a New York State issue, it's a national issue. And nobody's raising the alarm, and that's the thing that worries me the most. So we need to start raising the alarm.
Let me just check in here. Legislator O'Donnell, are you still with us? Do you have anything you'd like to add to this conversation?
just a very quick comment to support what the commissioner was saying. It was 2 or 3 months ago, I was just researching a company that happens to own 500 or 600 nursing homes nationally across the whole United States, about 35 states in our country. And their average at that point for all of those 500-odd homes that they had in the 35-plus states was almost exactly what ours was on that particular month. So I don't think we're any different here than they are everywhere in the country.
Doesn't make me feel that much better, but I guess misery in company or whatever that saying is.
Thank you, Mr. Chairman. I know that Chairman O'Donnell is going to be speaking about this on the floor, so I don't want to take away from what he's going to be discussing. But I just want to say that I fully am in support of his plan to push for hazard pay. And we know full well that your staff have gone above and beyond. And we know Orange County staff, you've all done, an impeccable job. And so, I'm fully on board of trying to support everyone who's been on the front lines of this pandemic. I know a lot of you are all burned out. I've worked with some of the health department workers and people in social services. Like I've seen it. They're exhausted, and they're working with some of the hardest cases in our county. So I just want to be on record applauding Legislator O'Donnell, our chairman, on that issue of hazard pay, and I'm definitely a big supporter. And your staff deserves it.
Thank you.
Okay, Donna, do you have anything else, or? Can you just move a little closer to the microphone? Oh, yes. Yes. Okay, now, with these are the amounts that you set aside, and how many of the projects have actually been completed? I know there was a long list. I mean, the oil, the burner, the, yeah. If you could give us a dollar amount of the projects that have been completed, started, how much money was already expensed and what's left. And so I think we'll have a good idea of where we are with all the projects. And when we came up with that list and that strategy, there was a long list of things that needed it. So, that would be a big help, Donna. Thank you. All right. I think, do you have anything else for us, or?
I think we've taken enough of your time. Thank you for listening to us and supporting us. The update, I sent out a quick one-page update. I covered most of it real quickly. Does anybody have any questions on it?
Yes. No, I think you pretty much hit,
I hit on all the high points, I think.
all the points there. Legislator Stock.
Are the workers also going to start getting the booster shots?
Yeah, we had, the Orange County Department of Health came on site. They did booster shots for both residents and employees. And we're going to be doing the booster shots for the residents, and we've been sending out booster shot information to our employees. They're readily available now, and they can, if they want to go out and get the booster shot, they can go out and get it on their own now.
For our department?
Yeah, I don't know how much the Orange County Department of Health is. I think they're having one actually this Friday. But anytime we have information on a new booster shot, or actually new booster shots, because now all of our staff are vaccinated, we send it out to all the staff, so.
Okay, good.
Yeah.
Thank you.
Yep.
Okay, thank you, Commissioner.
Thank you very much, appreciate it.
Done. All right, next up, we have item number 2. Dr. Rena Gelman, Commissioner of Health, Christopher Erickson, Deputy Commissioner of Health, and it looks like we have
You got it.
Chris.
I'm not
Deputy.
Dr. Gelman.
No, good. All right, and the first item up we have is item 2A, request to create 13 public health fellow ones, grade 10 positions, and 3 public health fellow 2, grade 12 positions. Legislative request number 197. Can we get motions? All right. Legislator Lujan and Tortel.
Thank you, Mr. Chairman.
Deputy Commissioner.
Yes, this program is in accordance with the New York State Public Health Corps Fellowship Program. The work involves responsibility for carrying out the tasks necessary to meet the county's public health mission. Incumbents will be asked and be assigned to a division within the Orange County Department of Health, and will work to support the current operations and increase preparedness for future public health emergencies. The funding for this program you approved last month, and this is a New York State program. These positions are being created to fill those. So this is a Public Health Fellow 1 and a Public Health Fellow 2. There will be 13 Public Health Fellow 1s and 3 Public Health Fellow 2s. These positions will be used in different areas of the department in our divisions for a 2-year period. Actually, it's probably going to be about a year and a half at this point, because they'll go into place hopefully in January, and really just to help our mission.
Legislator Lujan.
Thank you, Mr. Chairman. Thank you, Deputy Commissioner. Earlier this month at our legislative session, we had a number of individuals from the public who had shown concern about some of the funds that we approved. That if I remember correctly, I think that was passed unanimously. I was hoping that you might take an opportunity to anyone who's listening to be able to kind of explain what some of those fellows would do, just because, we want to make sure that everyone who's listening or who's paying attention to how we're allocating these funds and what we're going to be using them for, that they understand that this is going to, again, strengthen the mission of the health department and obviously support the residents of Orange County.
Right. Thank you for bringing that up. I appreciate that. I did listen to that meeting and listen to some of the concerns of the residents. And so again, these positions will be throughout the Department of Health. Some people will be assigned to the epidemiology division, where they'll be helping out doing some of the epidemiological data, collecting the data and researching and what we've created so far with COVID, also doing the community health assessment plan. Some of them will be assigned to our nursing unit and working specifically with the STI unit, which of course we've talked about in previous times of the need for having more staff there. Some of the staff will also be assigned to the community health outreach division. As you're very well familiar with the division we have there in Newburgh and work in Middletown also, they're really the boots to the ground doing public health education and getting out there and really helping the needs of our citizens out there and with their public health needs that may be going on. So I mean, we're going to be using them in various parts of our department and spreading them out. And each one of those public health fellows will have a supervisor that will oversee their work and will have to report back to the state as far as their deliverables each month.
Thank you, Mr. Chairman. Again, I just want to congratulate, and just I'm so happy to hear that the department is going to be using these funds. It's much needed positions that are going to support you, and I'm a big supporter, and I'm just glad of all the things that you've all been doing throughout this pandemic. You're all real heroes for us.
Great.
And we're very grateful. So I'm glad that you're getting these funds, and particularly because we've talked about this for the last 2 years about our levels of STDs and STIs in our youth. I think that's going to be a huge support, and I was really glad to see that we were going to be using these funds to address that, because it's been a recurring issue that we've talked about in budget for the last 2 or 3 years, and so to be able to address that finally is going to be really, really impactful. Thank you.
Legislator Anagnostakis.
Thank you. Chris, thank you again for all the work you do. Thank you for all the work the department does. I think we're all great supporters. I certainly have. I'm amazed at the work you did. This is a once-in-a-lifetime, hopefully, event, and everybody stood and, was able to fulfill their duties above and beyond. However, where is the doctor today? How come she's not here?
The doctor did have a pre-scheduled event that she couldn't get out of.
What kind of an event, if I may ask? Because
It was-
I had many, many medical questions, and I'm sure you wouldn't be able to answer them, so I'm not going to ask them of you. However, I'm shocked that the doctor is not here. And I usually don't get this tough, but there's only 12 basically opportunities during the year for the doctor to come before this committee to report to and to field questions from the legislators.
Sure.
And I'm shocked that she's not here today.
Yes, I'm sorry. She sends her regrets, but I will be more than happy to take any questions you have back to her. But it was something she could not get out of today.
Okay. Tell her that I'm sorry not to see her here today.
Okay.
Legislator Anagnostakis, do you want to ask anything, or you'll wait till? Okay, thank you. All right, any other further questions or comments? Not seeing any. Call to question. All in favor, aye? Aye. Opposed? Motion carries. All right, we'll move on to number 2B, request to accept and appropriate funds from the New York State Department of Health to extend the Maternal and Infant Community Health Collaboratives, MICHC, Community Health Worker Expansion Program, CHWE, for the period of 10/1/21 through 6/30/22 in the amount of $334,024. Legislative request number 198. May I have a motion? Tortel and Legislator Lujan. And go ahead, Chris.
Thank you, Mr. Chairman. This is the Maternal and Infant Community Health Collaborative. It goes to support 3.5 positions in one way or another. The MITCH program is what we refer to, is Supportive Education Home Visiting Program. We do home visiting in 3 of the cities, in Newburgh, Middletown, and Port Jervis. We conduct life plan classes for the ETA, BOCES, and Head Start, among many other organizations. We work with the local hospitals and health centers, as well as WIC, to enroll women in the program. We do outreach in the community to bring information to women about making healthy choices for themselves and their families.
Okay, and I see there's no grants attached to this. This is appropriation you're looking?
This is a grant, this is grant funding.
Oh, it is grant money. Okay, sorry. Didn't see that here. All right, any questions or comments? Call the question. All in favor, aye? Aye. All opposed? Motion carries. Okay, we go down to 2C, request to accept funds from New York State Department of Health for the Early Intervention Administration Program for the period of 10/1/21 through 9/30/26 in the amount of $1,204,500, which is $240,901 annually, and appropriate first-year funds in the amount of $240,901 for the period of 10/1/21 through 9/30/22. Legislative request 201. Can I have a motion, please? Second. Okay.
Thank you, Mr. Chairman. Yes. So this Early Intervention Administration Program, this pays parts of the salaries, some staff support. It also pays money into the clerical service pool and operational supplies for the county operations of that unit. It is grant,
Okay.
it's money from the state.
Any questions or comments? Called to question. All in favor, aye? Opposed? Motion carries. All right, we have number 2D to request to accept and appropriate funds from New York State Department of Health for the COVID-19 vaccine response grant for the period of 1/1/21 through 6/30/24, in a total amount of $1,078,776.96. Legislative request number 205. First, Legislator Lujan, and second, Legislator Tortel. Chris?
Thank you, Mr. Chairman. This is more funding for COVID-19 work. As you know, in the past, we've come in front of you with several of these types of grants. This funding will support a nurse position, chargebacks for county staff, education as far as like advertisement to promote vaccine uptake, and software for the department's electronic medical records program. You have that.
Okay, any other comments or questions? Not seeing any. Call a question. All in favor, aye? Aye. Opposed? Motion carries. All right, we have number 2E, request to appropriate second-year funds from the New York State Department of Health for the Children and Youth with Special Health Care Needs program for the period of 10/1/21 through 9/30/22, the amount of $66,000. Legislative request number 206. I'll make that motion. Can I get a second? Tortel. Any questions? Chris?
Yes, Mr. Chairman, this comes as a small amount of money, $66,000 here. Most of this funding goes to support a staff person in our EI unit. That's about really all I have to say about that.
Okay. All in favor, say aye. Aye. Opposed? Motion carries. Number 2F, request to accept and appropriate interfund revenue from the ELC COVID-19 grant to support overtime costs due to COVID response. The amount of $255,342. Legislative request number 223. Motion. Legislator Lujan, seconded by Legislator Tortel. Chris?
Thank you, Mr. Chairman. This is taking money from our COVID grant and putting it back into county lines to actually support the cost of overtime related to COVID. It's pretty straightforward.
Okay. Any questions? Call the question. All in favor, aye? Aye. Opposed? Motion carried. All right, Chris, we'll move on to the department update, monthly update.
Sure. So just a few highlights from what you've already sent you. Our call center is still really very busy. The number I have in there is actually wrong. We're actually about 150 calls a day, as of I just heard one of my division call meetings today. So we are still really, really busy with taking calls from the general public as far as, getting their vaccination card, where they can get vaccinations, boosters, all those types of things that we've been doing throughout this entire COVID operation. STIs continue to be very busy with their case investigations, as we talked about, and hopefully using, again, some of these fellows that we bring in, we'll be able to get those people trained and working in that department or that division. The ME's facilities continue to move forward. We are working with the architect on that, and we recently just got another submission from them. As we've kind of talked about with some of the dollar costs on that, we're seeing that dollar cost already starting to come down with their latest submission on this, which again is just, I think, a sign of the times as we're seeing all construction materials start to come down a little bit. We expected that to happen, and that's happening also. So we don't even have a shovel in the ground yet, and we've already started seeing the costs on that come down. Our environmental health division is very busy. If you want a real good indicator of how the county's doing as far as health with its economics, you can look at our environmental health division. Our engineers are super busy with doing reviews on new projects, with septic systems, with water systems, those types of things. Right now, our turnaround time on a plan review is about 60 days, which is really long. So they're working, just trying to get these projects out the door, but we'd like to keep them at 30 days, and we're at 60 days right now with the number of projects that are coming in. As far as your COVID update, it's out there in the news. We are seeing, cases consistently being higher, going up a little bit around the area. We are seeing clusters and cases throughout the county, and this it's continually out there. The wastewater program, the COVID wastewater program that we've been in place for several months now, is really starting to show us some interesting data, and it's giving us some information as far as what to expect in an area ahead of actually seeing the results. So it's doing what it's supposed to be doing as far as we can see trends with the viral load that we're seeing in the wastewater and the number of cases that are going up in a community. So it's really interesting, and it can, as we get more data on that, it'll start really building itself more. In addition to what we reported last month with the pods, we've conducted more of them at Middletown School District, Cornwall School District, Medline, and on last Friday, the 12th, we administered 276 boosters at the Emergency Services Center. And as Lawrence said before, we are doing, just as of today, I learned that we're doing another booster pod at the Emergency Services Center on Friday. We're going to be doing it for Pfizer and for Moderna there. So, and it's going to be limited again. Our goal is really to have people try and get their boosters through a CVS or some local place. We're trying to get out of the pod business, quite honestly, but we see that there's some need here. So every now and then we are doing a few of them.
And residents can sign up on the county website?
Yes,
Or Department of Health?
there's a link to it. Yep.
For this on, what date was that?
Friday. This Friday. 19th is that?
Yep.
Okay. Sure.
Yes, Legislator McNaghy.
Thank you. I'm not sure what you're going to be able to answer, but
I'll do my best.
do we have our epidemiologist here, at least?
She is not here. No.
She's not here either. Right. This is like a once-in-a-lifetime pandemic. I think our medical people should be here in front of the committee every time they have an opportunity. That's my 2 cents. Do we know right now in hospitals, people that have COVID, what are the breakdowns of people that have had a vaccine or fully vaccinated versus ones that are not fully vaccinated? Do we know the percentages?
Yeah, sure. On a weekly basis, our range of people who are I think it's like between 10 and 20% people who are coming up positive have been vaccinated.
Fully vaccinated.
Fully vaccinated, yep.
Do we know what percentage of immunity those people still have at this time period?
I don't know. Don't know that information.
Okay.
I don't know if we know that data, what percentage of immunity they have. 'Cause even us finding out, us finding out the number of people that have had a vaccination and have a positive case, that we have to really work to find that out, right? Because we get a positive lab case that comes into our office every day, right? We get the list of lab cases that come in. on that lab case, it doesn't say, hey, this person was also vaccinated. It doesn't report like that. So the only way we really know is when we call those people and we confirm that they have had a positive case, and we say, by the way, were you vaccinated? And we can confirm, and we can look that up, in the database. But it's
So
a
we
lengthy
can-
process to get to that
Sure,
point.
sure. So with that process, you would know how many people are passing away. You would know all the people that are passing away. You know how many of them have and have not been vaccinated. What are those statistics
The number of people that have passed away that have been vaccinated,
that have been vaccinated? Right. If you know one, you know both.
yes. I don't have that data right here.
Okay.
Number of people. We can definitely get that. And the numbers are, and we've reported on that a few times as far as the number of people that actually die from being vaccinated. It's usually someone who's much older, has lots of comorbidities, those types of things.
What's the doctor's opinion of the new drugs out, the new pills out by Merck and Pfizer? What's the efficacy of them in her opinion?
She hasn't given an opinion on that, to my knowledge.
Okay. Are we getting supplies of those drugs in this county?
Our Department of Health is not getting those supplies
Why not?
because that's not part of our job as far as giving out those types of.
But the federal government at one point was contracting out with both those companies to get, I believe, 10 million pills from one, and I'm not quite sure how many from the other. I assume if the feds are getting it, they're passing it to the states. If they're passing it to the states, I assume it would have to make its way to the county. Does the doctor know anything about that?
I have not heard anything about the counties getting anything passed down to us in that form.
Okay. Do you have any opinion of those particular pills and their efficacy?
I don't, quite honestly.
Do you know what they're for?
The pills themselves?
Yeah.
I mean, if you're talking about the ones that like the antivirals?
The Merck and the Pfizer one that was just, I believe the Merck was approved, and I think Pfizer just put an application today or yesterday for approval.
Right.
And supposedly if people, well, I shouldn't be telling you this, you should be telling me this, right? If people get a test and they're positive and they get these medications, these pills, within the first 3 to 5 days, it prevents any serious things from
Right.
happening forward.
It works very similar to like an antiviral drug that you get for another flu.
I'm not a doctor, so I don't know.
So, my opinion is that the vaccinations are the strongest way to go to get that. If someone needs to get an antiviral type of drug after they already start having symptoms, and they want to, I can't understand. Here's my opinion. I can't understand why somebody would not be okay with getting
I agree with you.
Okay.
But I think the use of those is the fact that how many, 40% of the people in this, what's our rate right now of vaccinations in the county?
60%.
Yeah, 15.
60%. So 40% of the people are not getting the vaccine. And so if people are dying in the hospitals because they're not getting the vaccines, that's what this is potentially available. I would have liked to have the doctor here to be having a back and forth. Thank you very much. I'm sorry I took up everyone's time.
No problem, legislator. Chris, if you could get that information and get that out and send it to Doreen, that would be great. All right, I'm going to take one more question, then we're going to wrap this up. Legislator Tortel, you had your hand up before.
Thank you, Mr. Chairman. Chris, I'd like to also chime in on my frustration as well as my colleague, Legislator Nagustakis. No disparaging to you, but there are very specific questions that only a commissioner who's a doctor can answer that this board, this committee will have. So please extend my disappointment in her inability to be here this evening. When you send those rates, I would like to see not only, as Legislator Nagustakis is asking for, the people who have passed who did have a vaccination, the level of the vaccination, whether they had 1 shot, 2 shot, Moderna, Pfizer, Johnson & Johnson. I would also like to know on the people who have tested positive for COVID in the last, let's go with month, 3 months. I'd say 1 month, how many of those, what their level of vaccination was? Whether they were vaccinated, whether they had the J&J, or they only did 1 of the 2 shots of the Moderna or the Pfizer.
Okay. I mean, we only consider someone vaccinated after they've had their 2 shots. So, I mean, that's, if you're saying you have 1 shot, you're not vaccinated. So,
Okay, some people will say that I've had a dose and they haven't, and I know that that's not considered fully vaccinated. But under the CDC, they were saying it was like, partially vaccinated.
I will look to see what data we can get on that.
And then, thank
Okay,
you.
Thank you.
Thank you, Mr. Chairman.
Chairwoman Benelli?
Thank you so much, Mr. Chairman. In hearing the discussion this afternoon, it prompts me to make a suggestion here this afternoon that for colleagues that are sitting on these various committees, if you do have questions that you would be preparing to answer or ask at these various different committees, to get in touch with the chairman of the committee and/or the department head so that they can come fully prepared. The questions that the dialogue that's been going on right now to Mr. Erickson really isn't fair because he's not prepared to answer those. And as you both said, he is not Dr. Gilman. He is not a doctor. He does a great job as deputy commissioner, and he does try, but I don't think it's fair to be able to question him on things that he's not prepared for. So I would make a suggestion that ahead of time, you obviously have some very valid concerns, very valid questions, but get them out there so that we can have a good, thorough discussion at the committee meetings. Thank you.
Thank you, Chairwoman. Okay, thank you, Deputy Commissioner. That
Very
clears the
much.
desk.
Appreciate it. Thank you.
That clears the desk right now. I'd like to take a motion to adjourn. Legislator Lujan, Legislator Tortel. All in favor, aye? Aye. Meeting adjourned. Thank you all.